Well, thank you very much, Wyatt, for having EY and me again. As an ex-biochemist, I am excited, optimistic, and you can walk around the showcase floor here, and there's so many examples of great innovation. The sadness, though, that I have is we don't scale it fast enough. And so in the next 15 minutes or so, I'm going to canter through at pretty quick pace. There is more detail on ey.com/life sciences and also my own LinkedIn page and full of detail. So this really is a taster of really how can we jumpstart innovation to really unlock the power of data to really deliver value-based care. So just to kick off, we all know healthcare is going through lots of change, and I look at this always in sort of 5 ways. We've got lots of economic pressure, not least now with the cost of living crisis. The majority of healthcare systems around the world are public, and so there's a real drive to push new innovations to prove their value. We've got lots of pressure in terms of efficiency, but we're really moving to how can we actually deliver innovation in intelligent technology infrastructures. We've got the opportunity that technology brings us, and that actually requires everybody in the healthcare arena to really acquire new capabilities and or partner with others who have such capabilities. And really interesting, what a great, fantastic talk we've just had. We have patients who demand an experience, not just a treatment. And of course, we have the horrific workforce shortages. So all of that sort of is a whirlpool of how do we actually move from what we have today, which is a pretty good functioning system. I would argue if you move up this trajectory from sort of the historic analog ways to sort of digitized care, sort of using data technology to help with diagnosis, we're sort of there at the moment. I'm very optimistic that we could move into a more connected care where we actually bring and use data sets from other people in the healthcare system to be more predictive in terms of what treatments are right for individuals. And then, the nirvana, and who knows when it will be, is we have a truly intelligent, smart ecosystem operating with defined interoperabilities, and healthcare data is pushed and pulled, not held in big epic Cerner systems in big traditional hospital settings, but we utilize the explosion of health data that exists in the ambient world around us. And that intelligent health ecosystem, and you can sense the enthusiasm I had for it, will really, really drive innovation much faster. I've mentioned, it'll be hyper-connected, data will be exchanged, it'll intelligently learn. We have now AI that is actually cognitive as well as computational. I'll come on to chat GPT at the end. But the benefits for all of this will be that treatments can be personalized. The patient is important, that patient journey is important. Many medicines and treatments don't work, but it's a bit of a lottery which works for some and which works for others because we're all different. So it's really, how do we get there? How do we embrace technology to really scale innovations to deliver or get us to that interoperable, intelligent health ecosystem? Ultimately, where access will be better, it'll be more affordable, it'll be more effective, and it'll be personalized. So what holds us back? It's not really technology advancement. It's us as humans and how we embrace it. If we draw some analogies to tech, I can see, we've had the mainframe, maybe the mainframe and PC, and maybe that's where we are with healthcare in that digital world, the diagnostic world. And then we move to the wearables, the smartphone world, and maybe that's a connected world. And the ambience that we're going to, you hear the tech companies talk about it, technology will ambient, it'll be around us. We won't even really know it, we'll sense it. Facebook started looking at how you can actually just read and think. You can think something and it's almost as if you've read it and you've acted upon it. How can you make technology ambient around it? And that's where I think healthcare could really go in this smart, intelligent ecosystem, where we perhaps have sensors in our living spaces, in our workplaces, in mobility spaces that can help us live more productive, healthier lives. So that's sort of the vision. And I was a bit disappointed when I asked the team to, do a scan of, where are we in terms of examples that are digitized, that diagnostic phase, examples that are connected. And you can see the definitions at the bottom, sort of almost starting to predict and personalize care, and examples that are really smart. And are they at the pilot stage? Are they at the deployed stage? Are they at the mature stage? And you can see, well, the cluster speaks for itself. The coloured dots are, in terms of biopharmaceuticals, life sciences companies, are these examples in commercials? Are they in drug discovery, patient engagement, R&D, etc.? But it wasn't such a promising picture. And I thought, oh, okay, so what's that? That really started us on the journey of thinking, well, what's really stopping us? And to go into a bit more detail, what do I mean? This is a great example of respiratory disease. We used to treat it with an inhaler. It was a device. It had a cartridge. When you felt you needed something, you had a puff, and it sort of expanded your airways. What we've got now is actually an inhaler, which it has a device in it. It measures how many times we might use it. We actually have got some examples now of sensors. I think it was GSK a few years ago did a partnership with a weather prediction company that actually could inform patients if it was going to be bad weather for their respiratory illness to perhaps take a double puff versus a single puff. Now, obviously, I'm being a bit flippant, but you get the idea that it's starting to interact. But joining a weather forecasting company with a biopharma company is not a marriage, a partnership that traditionally we would have thought of. And the truly smart system, though, is a bioelectronic implant that detects in our cells a neurological trigger as a result of an environmental factor that might trigger inflammation in our lungs, and then, of course, that then needs the medicine to help it. But it's that prescriptive intervention before we actually get needing any medicine that actually stops the inflammation. That is truly smart. I'll do one more example here. This is post-operative hip replacement. We used to get a booklet. Now we might have an implant in some of the sensors. And if you want the slides, I love people taking pictures. It shows you like the slide, but they are available, as I say, on the EY website or my LinkedIn. We might how the sensor in the implant is telling us, it's diagnosing if the implant is working or not, is it wearing out. We move into sort of a bit more interactive, smart sort of physio session that's on demand when we want it, maybe nudges us to do it rather than actually having to go to a physical space. But the smarter thing to do would be have a digital twin on a device that actually reacts, depending on how our bodies are working post-hip replacement. We'll tweak those exercises real time and monitor how we're doing it. I'm going to skip the next example in the interest of time. So all of this stuff is great, but as you see from the dashboard, we're not really scaling these really innovative innovations. And you go around the floor, as I said at the beginning, and you sort of ask yourself, how are you going to scale this? How are you going to partner with folk who have capabilities that you don't necessarily have? So how can we steer the utilization of health technology to really scale and move us up that curve through digital to connected to truly smart? And it was at a workshop relatively recently, and in the room there were patient advocacy groups, really representing patients. There was life sciences companies, payers, providers, and it was really clear that we're just not aligned on what we really value. as groups. I think the speaker just now are fascinating. You know, that the physician was really focused on the treatment, and actually, was that really right for the patient? But if you really think about what do patients value, what do providers value, payers value, policymakers, and life sciences companies, they're all really the 5 main stakeholder groups in healthcare. A patient, I want access to treat the right treatment. As a provider, I want the most effective treatment. As a payer, I want cost-effective solutions. As a policymaker, I want to understand the risks at the population level. And as a biopharma company, I want to get my new innovations approved faster and at a price point at a level that enables me to sustain innovation. So, you know, they're connected, but they're not the same. And that is the crux of the conundrum, I think, that listening to these groups of people, they actually fundamentally want different things or value different things. So that then goes to what do they prioritize? You know, a patient prioritizes different things from a provider to a payer to a policymaker and med tech. You know, if you think about the provider here, I want to have innovations to have algorithms to assist me in delivering treatments. As a patient, I want to be sure that my diagnosis is right. I want to be sure that the treatment's going to work. As a payer, again, it's evidence and value for money, clinical safety for a policymaker, identify patients for trials and market access if I'm a life sciences company. Again, so that what you value drives a different need and thus drives a different prioritization agenda. And that's really the message that I'd just love more people people in the industry to think about, well, what I want, but how can I flex and talk to others what they want? Because I think that will start to drive a much faster scaling of the innovations that we have. And we sort of then, a bit like the maths that we heard before, you know, life and business models follows a sort of really product maturity curve. And I think the trick in terms of how we scale innovation is how do we jump from one innovation curve to the other? And in consulting, we call this jumping the S-curves. But I think this is how, if you use data and health technology, how can we jump these innovation curves to go from digital to connected to smart? It's all about, in the bottom left-hand side, you know, come up with the idea, great, we've got lots of ideas, but then align and recognize the ROI with other stakeholders. Then prove it out with evidence and data, then continually refine it and collaborate. And then we will be able to jump these S-curves from scaling the innovation and not just having pilots, but actually scaling and delivering the value and moving up, as I say, that analog to digital to connected and to smart. And what's interesting when you analyze what's important when you get to a digital diagnostic health system and when you get to a connected health system and when you get to a truly smart health system, the biggest difference in need in terms of how to make it work is the necessary collaboration with an increasing number of stakeholder groups. So really the conclusion is if you really have to understand how your product, how your innovation is going to work for the different needs and prioritization agendas of the different stakeholder groups, and actually then you'll be able to scale much more quickly. The last element, though, that I also want to point out, and the previous speaker articulated it very well, it's not just what, it's how we as patients get treated. And we are living in a world of experience. And you can see here Amazon and Netflix and Airbnb. But if you boil down what success looks like for them, and it should be no different in healthcare, it's all about characteristics that drive the experience. So is healthcare, or could healthcare be more convenient? Could it be more seamless? Could it be more predictive and personalized? Is there a lot of choice? And how transparent is it? So I think then, you know, you really have to, I'm going to skip that slide, you really have to think about how can you really then unlock the power of data to deliver something that is scalable, something that's intelligent, that is a health experience. And this is the single slide as consultants use, but the single thing I talk to most biopharma companies about, because arguably they are the ones who potentially have the deepest pockets for innovation. But if I think that encouragement is if you're not thinking about how you are driving an intelligent, and maybe it's connected at the moment, maybe it's just digital at the moment or relies on a digital system, but how do you actually jump those S-curves and collaborate to go from digital to connected to smart, but to deliver that health experience? That's where the future value of your product really is going to deliver for the healthcare system at large. So I think I'm almost out of time. So just to summarize, please, as we're innovating and we're coming up with some fantastic ideas, but align on the value, the clinical and the non-clinical measures with more than just one stakeholder group in the healthcare ecosystem. Collaborate, and you can only collaborate if your interests are aligned or recognized. Think about user experience, really think about how we can personalize therapies and use sensors wherever possible on the patient that are ambient to actually give feedback loops and to fine-tune the treatment pathway. I'm going to... Oh, ChatGPT, I did say, even if you look up on ChatGPT, what is value-based healthcare? It comes up with quality of life, data analytics, patient experience. So, value-based care and alignment is really here to stay. So, thank you very much.